reproductive tract is having some special case. If you look at the size of the uterine valve, it is somewhat larger, and as I'm just going to tap the uterine wall, you can feel this is the resilience and fluctuation in the wall. The uterine wall is somewhat thin as compared to the other normal animals. If you look at the uterus of this animal, this is the uterine wall is somewhat thicker, plus there is no fluctuation, or you can say no resilience, because there is no fluid inside this uterus. But if you look at the tract of this animal, this is having some special condition that is usually known as hydrometra. The accumulation of abnormal fluid in the uterus is called hydrometra. Why I'm saying that this is the hydrometra? Because you have to differentiate it from the pregnancy. As in pregnancy, there is enlargement of the uterine horns, and there must be fluid, pregnancy fluid in the uterus. If you look at the size of these both horns, if this animal was pregnant, suppose that, then there will be clear asymmetry. The gravid horn will be larger than the other horn. And then we also look for some other changes in the reproductive tract that are related with the pregnancy. For example, you will look for the fetal membranes, you will look for the placentums or fetus. So there are no pregnancy related signs in this reproductive tract, just the enlargement of the uterus, and plus you feel that this is the somewhat fluctuation and the uterine wall is thin. So this is a very typical case of hydrometra. What is hydrometra? Hydrometra is just the accumulation of abnormal fluid in the uterus, and the cause of the hydrometra, particularly due to some kind of the obstruction in the cervix, that can lead to the formation, or you can say the accumulation of the abnormal fluid in the uterus, and sometimes it can be the sequelae of the you can say long-standing cases of endometritis, and in some other you can say scenarios it can be due to you can say cystic ovarian degeneration. Sometimes if the animal is having cystic follicles on the ovary and the increased secretory activity of the uterus, plus if there is again obstruction, then this abnormal fluid will use to accumulate within the uterus. It is not coming outside because there is somewhat blockage in the cervix. Okay, so most probably the cause of the hydrometra is the you can say obstruction in the cervix, but sometimes it can be due to some other situations that can be the sequelae of the chronic endometritis in some situations, and it can be due to cystic ovarian degeneration. And in particular cystic ovarian degeneration, sometimes we used to say that it is mucometra. So it depends. If the mucus is inside the uterus, it will be mucometra. If it is the fluid, just water-like, or you can say the consistency or viscosity is just you can say the not as much as the mucus. It's not thicker than the mucus, then it is the hydrometra. So to me, this is the clinical. If you look at the picture, there are no ovarian structure on the ovary, no persistent follicle, no cystic ovaries. It's not. You cannot say that this is due to the COD or cystic ovarian degeneration. This animal is in deep anestrus. If you look at the ovaries of this animal, it is in the deep anestrus. There is no evidence of any follicular activity or luteal activity on the ovaries, and the surface of the ovary is somewhat rough, and shape is just you can say somewhat elliptical, elongated and flattened, and the fluid inside the uterus is you can say it's known as hydrometra, and we're just going to explore it inside what kind of the fluid it is, either it is the exactly the watery fluid or somewhat you can say mucus. Plus we are just going to explore either there is any you can say obstruction in the cervix, and then we can have a clear picture. Finally, I can check for the obstruction by just passing the uterine catheter. If there is somewhat obstruction in the cervix, I can have a picture. There will be problem by pass the uterine catheter in the cervix to the uterus. Plus, if there is no obstruction, we can just come with the fluid inside the uterus and collect it by the help of the uterine. To me, there is somewhat obstruction. I feel like that there is somewhat obstruction in the cervix. The obstruction can be due to some previous injury inside the cervix, due to some kind of manipulation by any instrument that is being used for examination or for some other procedures, or if there is some history of dystocia handling, that can also lead toward the some kind of injury within the lumen of the cervix. It is within the lumen of the cervix. It can lead toward the stenosis by the some you can say overgrowth of the healing tissue. Okay, or sometime if there is thick mucus inside the cervix, it is going to block the passage of the cervix. To me, there is some kind of obstruction. We are just going to explore what kind of obstruction it is. The obstruction here you can look, there is a very clear picture of some fibrous tissue inside the lumen of the uterus, the cervix. Inside this lumen of the cervix, you can look over here. This is a you can say the very firm fibrous tissue. This can be the, you can say indication that there may be some kind of the injury within the lumen of the cervix previously, that is, we can say, just obstructing the passage of the cervix. That's why this fluid was just accumulating inside the uterus and is not coming outside, making the enlargement of the. Here you can see. So this was basically due to obstruction in the cervical canal.